Hello, my dear students. So, I am here. I am Dr. Anya Kulkarni, your guru for the subject of pedodontics, and I'll be telling you, we'll be discussing together the questions that I gave you for the NEET Grand Test number 12 for the subject of pedodontics. All right, so let us begin with the discussion. The first question that was given for the GT12 was, given in the picture is a three-dimensional anatomical rubber dam. In which year was it first launched? So this is a recent development. This particular dam, this particular rubber dam is called as Optra dam. What is it called? It is called as an Optra dam. Optra dam. Okay. So, Optradam is a brand name for a specific type of dental rubber dam used for isolating teeth during treatment. You all know what is the function of a rubber dam. So, this is a specific type of a rubber dam only. Unlike the traditional rubber dams, Optradam is an all-in-one pre-framed. So, this is a pre-framed one. You need a different frame for a rubber dam, right? You have a rubber dam frame there. But this is a pre-framed. Okay, this is a pre-framed three-dimensional latex sheet, right, designed to simplify application and improve patient comfort. So this simplifies the application because you don't need a separate frame, and it'll keep hanging there. You need to punch it and stuff like that, so you don't need a separate frame, etc., for it. So it is a three-dimensional pre-framed latex sheet which simplifies the application and also improves patient comfort. It automatically stretches to fit onto the mouth. It stretches, creating a dry and clean working field for procedures like fillings, root canals, cosmetic work, etc. So Optradam was actually first launched in the year 2005. So it was launched in the year 2005 by a company called as Ivoclair. Okay, so Ivoclair actually first launched the Optradam, right? So the answer is C, 2005. Question number 2 is, Eric Erickson's psychosocial stage for children aged 3 to 6 years is which stage? So we've all read about Eric Erickson's stages. So according to Eric Erickson's stage, we have uh, um, initiative versus guilt. So initiative versus guilt is a stage that is for age group 3 to 6 years. That is the preschool age group, 3 to 6 years, also called as the preschool age group. Okay, autonomy versus shame is 1 to 3 years of age group, that is for the toddler age group. Then we have industry versus inferiority, so that is in the school age, that is 6 to 12 years of age, which is called as the school age. Okay, and then we have identity versus role confusion, that is 12 to 18 years of age group, which is adolescence. Okay, so what they had asked is 3 to 6 years of age group, that is initiative versus guilt for the preschoolers, right? The next question is, which of the following technique was introduced by Adalston? So out of these techniques, restraint, tell, show, do, voice control, distraction, which of them was introduced by Adalson? So Adalson introduced the technique, as you know, tell, show, do technique. Okay, so tell, show, do technique is basically a core behavior guidance technique. Tell means to explain the procedure in a child friendly language to the child. So when I say child friendly language, it means by the use of euphemisms. I hope you all know what are euphemisms. Euphemisms. Okay, the color has changed. Right. So, use of euphemisms. You can tell the patient what is to be done. Then you show the patient by demonstrating it with the help of either a model or in your hand, in the air, something like that. So, you show or demonstrate the procedure with the instrument to the patient. And then you do, that is, you perform the procedure. That is the tell, show, do procedure. Okay, so that it will reduce the fear, builds trust, and improves the cooperation of the child patient, right? Then again, there is restraint and sedation. They are used only if the tell-show-do does not work and the child is still uncooperative. Okay, so it is effective in case of cooperative children who are anxious. So their anxiety reduces when you apply this technique, that is tell-show-do technique. The next question is, social learning theory inculcates which type of behavior management technique? Okay, so there is a theory in child psychology, that is the social learning theory. So it inculcates which type of behavior management technique? So it inculcates modeling as its technique of management. So basically, modeling is when a child observes positive behavior from a parent, peer, dentist, etc., and then imitates it. Okay, he copies that positive behavior. So social learning theory was given by Bandura. Okay, I'll take a darker color. Social learning theory was given by Bandura, right? So he said that learning occurs via observation and reinforcement. So learning occurs when you observe a particular person or a model and then and it becomes reinforced. You try to imitate it. Okay, so you can use models, cooperative children, siblings, peers, etc., to the patient to observe, right? The next question, that is question number 5, is most of the children have an IQ of. So when you look at the classification of the IQ range, you see that most of the children have a IQ score of 90 to 110. The answer is B, that is 90 to 110. Okay, so IQ can also be measured by a formula, that is IQ is equal to mental age divided by the chronological age multiplied by 100. So this is a formula that is used to calculate the IQ, and most of the children fall in the IQ score of 90 to 110, right? Okay. The next question is, according to the Freudian psychosexual stages of development, the stage corresponding with the development of mixed dentition and character formation is which one? Okay, so when we talk about the mixed dentition, it is around 5 to 6 years of age it will begin, and it will continue up to 10 to 12 years of age. So in this particular age, the answer is supposed to be B, that is latency phase. So latency starts around 5 to 6 years and continues up to 10 to 12 years. It is characterized by maturation of ego, develops a greater degree of control over instinctual impulses. The child gains better sense of initiative and starts adapting to adverse environment. So the answer is B, that is latency phase. The next question is, fear is more common in. Okay, so fear is more common in idiotic child, intelligent child, autistic child, or cerebral palsy child. The answer is fear is common in an intelligent child, a child with a fully developed brain that is normally functioning. Fear is common in that child. So intelligent child is more concerned with fears. An intelligent child is more adept at comprehending his surrounding environment and assessing his reaction towards the stimulus that he is receiving. On the other hand, autistic children, children with cerebral palsy or low IQ, are not fully adept at comprehending their surroundings and interacting with them appropriately. So the answer is an intelligent child. The next question is, the phallic stage defined by Freud is seen in the following age group. So the phallic stage, that is defined by Freud in the psychosexual stages that he gave, the phallic stage falls in 3 to 6 years of age, where you read about the Oedipus complex and the Electra complex. That is the phallic stage, which falls in the 3 to 6 years of age group. Right? The next question is, the ideal method for restoring a fractured tooth is. So, what is the ideal method for restoring a fractured tooth? Whether it is open phased stainless steel crown or reattachment of the fractured tooth segment or strip crown, composite resin restoration. So, the most ideal method is reattachment of the fractured tooth segment to the tooth structure. So, reattachment of the crown fragment to the fractured tooth is the best method to give the natural shape, contour, surface texture, occlusal alignment, and the color of the fragment. This will offer excellent aesthetics and functional results with less chair time. So, that's the most ideal method of restoring a fractured tooth. Right? Coming on to the next question, which is pain due to thermal change after trauma will occur during. So when will the pain occur after thermal due to thermal change after the trauma? Okay, so whether it will occur if there is periapical inflammation after trauma, or periapical necrosis, or PDL injury, or root fracture. So the answer here is pain due to thermal change after trauma will occur in case of a root fracture. The answer is D, root fracture. Right? So, pain caused by thermal change signifies pulpal inflammation. In case of a root fracture, the pulp will be injured, which will lead to inflammation of the pulp. Okay, periapical inflammation does not mean pulpal inflammation, it might mean necrosed pulp. Again, necrosed means necrosed. Pedial injury also does not require to have pulpal inflammation, but root fracture will result in pulpal inflammation. Okay, of the pulp, and any thermal pain caused by thermal change signifies pulpal inflammation. In case of root fracture, the pulp will be injured, lead to inflammation, and it will it will increase the extravascular fluid, which will lead to increase in intrapulpal pressure and lead to the patient experiencing pain due to these thermal changes. Right? So the answer here is D, that is root fracture. Question number 11 is, the following material with a hemostatic effect can be used as a substitute for formocresol pulpotomy. So, what can you use as a substitute for formocresol pulpotomy? So, the answer here is B, ferric sulfate can be used as a substitute for formocresol pulpotomy. So, basically, the pharmacological agents which can be used for pulpotomy in primary teeth are formocresol, glutaraldehyde, calcium hydroxide, collagen, ferric sulfate. Non-pharmacological agents can be electrosurgery, laser, and ferric sulfate with electrosurgery. So these are the agents that you can use for pulpotomy. To replace formocresol pulpotomy, the best is ferric sulfate. Okay, so the answer here is ferric sulfate. Question number 12 says what? So, the question number 12 is, the most common dental procedure contributing to vertical root fracture is. What can lead to, what is the most common procedure that can lead to vertical root fracture? So, the most common procedure that can lead to vertical root fracture is the endodontic treatment. So, when you do an endodontic treatment and do not put a crown over it, the tooth is hollowed from inside due to the treatment, and then a large occlusal force can lead to vertical fracture of the tooth. So vertical root fracture is common after endodontic treatment because it removes most of the tooth structure by access opening and shaping the roots. It is almost most common in root canals where the post is placed. So where you do post and core treatment, there it is very common for the vertical tooth fracture to occur. Right? Then comes the next question, that is question number 13. So, what is question number 13? Question number 13 says concussion implies luxation injury. So, which type of luxation injury does concussion imply? So, the luxation injury caused due to concussion occurs generally without displacement and has a normal mobility. So, there is no displacement and there is a little bit of mobility, not heightened mobility. Concussion is characterized by blunt injury, an injury of the tooth support structures without increased tooth mobility or tooth displacement. But with reaction to the horizontal and vertical percussion, it may be associated with a crown fracture. Concussion means a blunt injury that can disturb the periodontal ligament fibers a bit, so there is slight mobility and not a lot of or heightened mobility. Right? Brings us to the last question of this session, that is question number 14. So, what does it say? Crown infarction is. What is crown infarction? Infarction means crack. So, it is just a crack. So, the answer is an incomplete fracture of enamel without loss of tooth structure. So, it is just a crack. There is no loss of tooth structure. It is an incomplete fracture because it's just a crack. So, you'll be able to see it as craze lines or crack lines, especially if you transilluminate it, you will be able to appreciate it better. Okay, so the answer is incomplete fracture. So if you all have any doubts regarding this, you can reach me in the group, Telegram group, and I hope you understood why the answers were the answers that they were. And thank you so much.